talking about sexually transmitted infections, how to prevent them, how to detect them, how to treat them. In other words, trick or treat. To be blunt, it's called a sexually transmitted infection or a disease for a reason. It happens by way of an unprotected sexual encounter, not from the toilet seat, not from sharing towels, or from getting into that funky-looking jacuzzi. I'm talking about infections with gonorrhea, chlamydia, herpes, trichomonas, crab louse, HIV, hepatitis, syphilis. These are all the most prevalent sexually transmitted infections and diseases that we currently test for at a routine gynecologic exam.
So last night was amazing. #mind blown. I'm talking about didn't have a chance to put on a condom kind of sex. But I'm not worried. He seemed classy and probably doesn't have anything. Right?
Men typically don't display symptoms, which is why it's important not to play the game of condom relay when you are assuming that someone probably doesn't have an infection because they don't look like they do.
My boyfriend and I are only sleeping with each other, so I don't need to be tested, right?
The good news is most of these are tested by blood tests, and gonorrhea and chlamydia are now also available to be tested just using a urine test. So what does that mean? You don't actually have to have a pelvic exam to have yourself tested for STDs. Gonorrhea, chlamydia, trichomonas, they're acute infections. They usually become apparent when you have acquired them. If you have not been sexually active with anybody other than one partner and you've recently tested positive, that essentially implies that that partner has been sexually active with more than one partner. There are, however, STDs that can't be directly linked to your current partner, so hold off on chasing them down the street with a golf club. Infections including herpes, HPV, or syphilis can have a dormant phase and take several weeks, months, to even up to years before they demonstrate signs or become detectable on test results.
I keep forgetting to pick up my prescription, my antibiotics.
What antibiotics? What you got?
I mean, but I'm not having any symptoms, so I should be okay, right?
Women too can go for a very long time without showing signs or symptoms of an infection. Common symptoms or signs include pelvic pain, bleeding after intercourse, fever, chills, blood-tinged discharge, odor, feels like your uterus is on fire. Having the right treatment at the right time is critical. Treating chlamydia only requires a single dose of azithromycin. That's it, one dose, and you're done. If you are positive for gonorrhea, or we think you might be, then that's one dose of azithromycin and one shot of Rocephin. Okay, so you get one shot, and that sucks. Having a single infection can significantly impact your ability to become pregnant in the future. So making sure that you don't become infected is pretty important, just as much as it's important to make sure you don't become reinfected. It only happens by unprotected coitus with an infected partner. This means that if you're positive for an STD, your partner and you are both infected, you both need to be tested, you both need to be treated, you both need to abstain from intercourse during your treatment, and to be on the safe side, you probably should test and make sure that you clear the infection. I would probably also talk about safe sexual practices at that point and use condoms from there on out.